Good morning, everyone. Thank you for joining us here today. Unfortunately, I'm here to report there has been a significant and tragic development involving the growing Omicron spread. Over the space of just a few days, we've seen the number of local infections start to take off. On Sunday, we reported 31 local cases. Yesterday, we reported 37. Today, that number has increased to 51 local cases. That growth in local cases is what we expected since Omicron was first detected in Perth on January 2. It is no cause for panic. However, we do need to ensure we continue our COVID-safe measures to limit infection risk. But we are starting to see a clearer picture of what we are dealing with Omicron continuing to spread throughout our community. The total number of new cases being reported is 99. That includes 48 arrivals, 35 from interstate and 13 from overseas, and also the 51 local cases. That brings our total number of active cases to 482 in WA. Omicron is well and truly here in Western Australia. Sadly, a man in his 70s with COVID-19 has passed away in Joondalup Hospital. I'm advised that WA Health has no record of the man receiving a COVID-19 vaccination. The man had been admitted to hospital after acquiring the virus in the community. He also had some underlying medical conditions. Whichever way you look at it, this is a tragic development. This is the second death of a person in Western Australia who acquired the virus locally since the start of the pandemic. Of course, our thoughts go out to the man's family and friends. I also want to publicly acknowledge the commitment of our health workers at Joondalup, both in intensive care and on general wards, who have been caring for the man. To all those health workers, can I say thank you? Today's development confirms what we as a community have been planning for. Omicron is here, and if you're not fully vaccinated, the virus can find you and it can have tragic consequences. As I've said before, Western Australia is now in a new phase of the pandemic, but there is no reason for alarm. It's a phase we knew was coming. This is precisely what we have been preparing for, and Western Australia has a major asset as we stare down this new phase of the pandemic. The people of Western Australia, who have done the right thing, followed the health advice, stuck to COVID-safe principles, and most importantly, Western Australians have rolled up to get vaccinated. To the point that the West Australian community is now one of the most vaccinated jurisdictions in the world. Western Australia has now reached a major vaccination milestone. Our first dose vaccination rate for 12 plus people has today reached 98.3%. For second dose, it is 94.2%. Our third dose vaccination rate now sits at, for 16 plus, 49.1%. But importantly, 1 million Western Australians have now had their third dose. 1 million people. This is an amazing achievement. 3/4 of those doses were administered in the past 5 weeks alone. That's equivalent to an Optus Stadium's worth of Western Australians getting their third dose every 3 days, which will help protect so many Western Australians as Omicron continues its inevitable spread throughout our state. This is precisely why we made the decision to delay our hard border reopening to give Western Australians the opportunity to get their third dose. Even though our 49.1% third dose rate is impressive, we still want that number to climb higher and higher as quickly as possible. So people, if it's been 3 months since your second dose, don't wait any longer. Omicron is here in Western Australia. Go get your third dose to protect yourself, your family and our community. The news of 51 local cases may shock some, and we can expect higher numbers in the weeks to come. But I can assure all Western Australians it is not a cause for panic, but it is a reminder to take Omicron seriously. To stay home when sick, to get tested, to follow the public health measures, and most importantly, to get vaccinated. The third dose makes all the difference in not only slowing the spread, but the severity of the illness and the outcomes if you find yourself in hospital. Right now, we're in the middle of our latest vaccination blitz. We know that many West Australians are still eligible for their third dose and haven't booked in. It's so important with Omicron spreading in the community. Vaccination is about protecting yourself, protecting your family, and taking the burden from our health staff. And with that, I'll hand over to the Health Minister and then return for your questions.
Thank you, Premier, and good morning and thanks for coming. I would like to start by acknowledging the family of the man who passed away yesterday, and I'm sorry for your loss. Our thoughts are with you at this very difficult time. Our thoughts are also with those people who have loved ones and are affected by the Joondalup Signet Residential Aged Care Facility outbreak. I know this is a worrying time for all of you, but I'm assured they are in good hands. The Department of Health is working closely with Joondalup Aged Care and the Commonwealth Government on this outbreak, and I'd like to acknowledge all of the efforts of those involved. The health and safety of all residents and staff is a priority, and the Health Department is doing everything that they can to assist. All cases and their identified close contacts are in quarantine and are being tested. All staff who work at the site are also being tested. As case numbers continue to grow, it is important that people continue to get tested. We are now seeing the consequences of having COVID in our community firsthand. So for the sake of the vulnerable in our community, if you are unwell or a close contact, please get tested. We have plenty of capacity at our PCR testing clinics, and this is the recommended testing method, but you can also use a rapid antigen test. If you use a RAT and receive a positive result, you must register your RAT test at healthywa.gov.au/RAT register. We continue to see a significant number of cases in returned travellers, but our local cases are still growing. So I urge everyone to do the right thing. Get tested if you're unwell or a close contact, and if you use a RAT, register your positive result. There are also other important things you can continue to do to protect yourself and others from the virus, including get vaccinated and your third dose as soon as you are eligible, check the exposure sites regularly, continue to use Service WA and Safe WA, and wear a mask in Perth, Peel and South West, the Wheat Belt and the Great Southern. And please continue to social distance when you are out and about. It is the responsibility of all of us to protect the vulnerable in our community. Yesterday we undertook 5,311 tests across public and private clinics. We have to keep this up. The higher the testing numbers, the more confidence we have in ensuring positive cases are accounted for and are in isolation. I'll now hand back to the Premier for questions.
Any questions?
There's the man that's died, he's not from Joondalup Aged Care. Just confirm that to start.
Correct. The advice I have is that he attended an event in the northern suburbs where he acquired COVID.
Was that at the Bowls Club?
That's the advice I have.
And are there any other people in hospital currently?
No. The latest figures I have are that in hospital with COVID in Western Australia there are currently none. In New South Wales there are 1,716, Victoria 553, Queensland 584, South Australia 210, and Tasmania 16.
Premier, he was so was he the patient that was on the ward? I think he'd been in ICU and then he was on a ward, or is he in ICU? I'm not sure.
I think he'd been in and out of ICU and onto the ward. Obviously, he had some other conditions, I'm advised, but he also had COVID, so it was obviously very difficult for him and his family.
Any indication why he wasn't vaccinated?
I don't know the reason, or the advice I have, and I'll go on the advice I have from WA Health, is they have no record of him having been vaccinated.
Just over 5,000 PCR tests yesterday. That's very low compared to the numbers that we saw earlier in WA and over East. Do you think that's because people are doing RATs at home, or people are just refusing to get tested?
No, I think the RAT numbers would be very high now. So I think the availability has increased. Obviously, we're providing them in various circumstances and environments, so I suspect that's driving down the PCR testing. So, but we'll keep our PCR clinics open so that as cases grow, the PCR opportunity is there, and someone might get a positive rat test and they want to get it confirmed by a PCR test, there's all those sorts of things as well. So obviously the numbers of PCR tests, we're encouraging people, if you've been to an exposure site, if you're unwell, if you're showing symptoms, please go and get tested. The PCR clinics are there, but many people, no doubt, are now choosing rat tests.
And do you have over 51 cases? Do you know whether any of those are from aged care facilities, or are they just a mix of community cases, the 51 local ones?
I suspect some of them were out of the aged care at the facility. Yeah, I would expect some would be.
As of last night, that aged care outbreak was at 8 cases, 6 residents and 2 staff. Do you know if that's grown at all overnight?
No, we haven't had those figures through yet.
I haven't had any advice.
And just on the subject of exposure sites, there hasn't been a Perth-based exposure site uploaded since Monday. The last 3 have all been regional petrol stations. What's going on there? Why aren't we seeing exposure sites updated more regionally?
You can come up and answer. I'll get the Health Minister to answer.
Sorry, speaking yesterday, Premier, you said you didn't know what the vaccination rates were in aged care homes. Did you get that clarification? So
what I did yesterday at National Cabinet, I raised aged care homes and getting more vaccinations out there. I understand we need to get more in there. The advice was that the Commonwealth is doing it progressively, but we've offered to help, and what we'll do is do our own approaches to aged care homes to see what we can do additional to get more vaccines into aged care. So whilst it's a Commonwealth responsibility, our vaccine commander, Assistant Commissioner, Deputy Commissioner Gary Drybergs will ensure that we play a role in assisting the Commonwealth where we can. The advice they gave us nationally was that some people in aged care choose not to get vaccinated because they're basically at the end of their life, and both them and their family have decided they don't want to do it. Now, I understand that. But for other people in aged care, it's just very important that we get as many of those people vaccinated as quickly as possible. In terms of actual percentages, the Commonwealth holds those figures.
They won't release those figures. I've tried requesting, media have tried requesting them. Is that good enough?
I'm not going to. It's up to them.
Is it frustrating that you've had to step in and start kind of complementing the Commonwealth's efforts in that space?
Look, we're happy to help. I don't want to be attacking them over it. We're happy to help. So we'll do what we can to assist them in this. As I keep saying to you, it is the Commonwealth's responsibility, but we want to help, and so we've made offers to help, and we're going to have a program of doing what we can to get more vaccines out there. But I do understand that some people in aged care don't want to get vaccinated because they might be in palliative care and they choose not to for an obvious reason. But for other people in aged care, it's very important we get as many of those people vaccinated as quickly as possible.
One of the measures that was taken over East was stopping people working between multiple aged care sites. So you're looking at anything like that here?
Yeah, I'll let the Health Minister answer that.
Just on the 3-jab regime, are you satisfied with the notion that it would be Australian citizens expected to be up to date with 3 jabs as opposed to the possibility of overseas tourists?
Well, we already have the 3-dose regime in place. So we moved ahead of the national arrangement there months ago. So as you know, our 3-dose mandate is in place for parts of the workforce. And that our approach to the vaccine has meant that we now have one of the highest vaccination rates in Australia and the world. I think our first dose is now above all the other mainland states, perhaps behind the ACT and maybe equal with Tasmania. So what we've done has resulted in massive take-up of vaccines. Our 3rd dose rate is increasing, I think the fastest of anywhere in Australia, so our 3rd dose will get up there as quickly as anyone and perhaps beyond anyone else. And it shows whilst our mandate regime was tough, it's actually been effective. And I know it caused a lot of pushback, but we're trying to save lives here. In terms of the other part of your question?
Yeah, the international tourists.
Oh, the international tourists.
You expanded to,
Yeah. So look, this is going to be a continuing subject of discussion at National Cabinet. There was a lot of talk about it yesterday because there's arguments on both sides. But I think trying to get as many people 3rd dosed, even if you're an international tourist, and if that requires some technical work, is a good thing to do. But we'll continue to have those discussions. It's obviously not particularly relevant for us at this point in time. But it will become relevant at some point in time in the future.
And you're currently only required to have 2 doses to be considered fully vaccinated for the purpose of a vaccine certificate.
Yeah.
Do you see that changing to 3 doses in Western Australia, and if so, when?
It will become relevant and required at some point in the future. There's some technical update needed on the, I think it's called the Service Australia app. And once that work is done and when people are eligible for their third dose, those sorts of requirements will kick in.
So you'd wait for everybody to be eligible
Oh.
for 3 months and then go to 3 doses?
I'd have to take technical advice as to how you do it based upon a person's eligibility status, but at some point in time, I expect that will become part of the Service WA app arrangement.
And proof of vaccination will remain a requirement well into the future, as you said previously, even though we now have, I think, 98.7% of people having received the first dose.
I think it's a good incentive to get vaccinated. Look, a lot of people have had difficulty downloading the Service WA app. I just encourage people to get help. There's help out there, there's information. If you've got friends or relatives that can assist you with it, just take that opportunity. And I know technology doesn't come easily to many people. Very familiar with that. But you know, there are people out there, particularly family members who are younger, who can assist you with these things. So I just urge people to seek assistance and persist. The app itself is actually outstanding once you get it. It's very easy to use. I just urge people to get assistance. There's libraries offering assistance, there's booklets we're distributing, there's online advice, and seek assistance. Members of Parliament are doing it. Lots of members of Parliament I know are providing this assistance. Just look around for who can help you.
Do you expect local cases will continue to outstrip travel cases, and how big of a factor is that in the border review that's being undertaken?
Well, the local case increase, I think it's outstripped interstate today. Whether it will in the future is probable as we get community spread. We'll do a review over February about the border arrangements, but obviously that will be one of the factors we take into account.
Are we looking at restrictions sometime soon as these cases continue to rise?
Enhanced public health social measures are being considered. As the number of local cases grow, well then you might go further than what we currently have. We currently have public health social measures, which I suspect is helping us keep the spread down. So mask wearing, I suspect, is helping us keep the spread down at this point in time, whilst we get our vaccination rates up. Enhanced public health social measures, no doubt, will be on the agenda shortly.
Will you hold off on things like the 2 square metre rule and gathering limits until the border opens? Will those things happen at the same time?
I don't think those two things are necessarily linked.
Premier, can I get you on other matters of the day?
Certainly, Emily.
We've had the grand final here. Why couldn't we have the Commonwealth Games at Optus Stadium?
Well, these things cost over $1 billion. The grand final didn't cost us anything. We got that for nothing. Other states paid lots of money for it. We didn't pay anything for it. So that was a good deal for Western Australia. But the Commonwealth Games will cost over $1 billion, and that's before blowouts. And we know there'll be lots of blowouts. So our priorities are health, new women's and babies hospital, 1,100 extra police, strongest spending on health of any state in Australia, making sure we build more social housing, diversifying the economy, and making sure we are prepared for what the future throws at us. We live in a very uncertain world, as we've seen, with COVID, with international developments, with a whole range of things. And retaining financial capacity to deal with those sorts of things is actually important. Now, if other states like Tasmania want to use the GST money we give them to spend on the Commonwealth Games, that's their choice. But our priorities are elsewhere.
Would it not be a good opportunity to sell Perth to the world, though? Presumably COVID will be behind us by 2026. But, I mean, wouldn't it be a good opportunity to sell Perth to the world?
Well, I announced a big tourism investment package yesterday and another one back in December of last year, and we'll do more. The good thing about our experience of the last 2 years is by keeping COVID out, having the strongest economy of anywhere in the world, our financial position as a state is stronger than any other government in Australia. And that means we can invest in things like tourism marketing campaigns, aviation campaigns, international education campaigns, all of those things that will make a real and appreciable difference for years to come for those industries. And that's because we kept COVID out. Now, Victoria, they have $17, $18 billion budget deficits. New South Wales is roughly similar. Other states are all in a very difficult position financially. But because we kept COVID out, we kept all of our industries operating effectively, we're in a much better position, and that allows us to invest in recovery initiatives that make a real difference.
Some people are still having a difficulty trying to put the Safe WA app together, and a lot of our viewers telling us that when it comes to MyGov ID, that kind of stuff, they still don't recognise the valid documents that you go through, jump through the hula hoops before you can link those apps together. Are you concerned about that?
That's a very good question. I am concerned, and I just urge people to seek assistance. So as I've said, I got the assistance of my 16-year-old son, and he sorted it out for me. I just urge people to seek assistance of relatives and friends. As I said, members of Parliament, some of them are doing it, some libraries, we have information out there and we have the COVID helpline. So there is assistance out there, even if it's frustrating, and I know it's frustrating. But this system and technology is just the way of the world these days, and people need to, if they can't do it themselves, get someone to help them achieve it.
I mean, for senior citizens, though, shouldn't the federal government just be mailing these certificates out to them so they've got something to pull out of their bag when they turn up at a place? I mean, that seems to be the issue.
Well, I think you can use, it's not just Service WA app, there are other ways you can prove your COVID status involving ID and other certificates, but you know, I think we're up to around 40% of people have downloaded the Service WA app, perhaps more, and no doubt those numbers will climb.
Ned Power and his son have indicated in court today that they will plead guilty to the border breaches. Can I get your response to that?
Well, I won't comment because obviously they still have to go before the courts, and you know there'll be whatever penalty imposed. Anything I could say might impact that.
A breach as flagrant as that, though, hypothetically, should they
Other
have known
people
better?
have gone to jail for less.
I'm not going to try and influence the courts.
Just on the AFLW women's teams that are coming here, they've got to be triple jab.
They have to comply with the vaccine requirements, whatever.
Some suggestion they don't have to be triple jab.
Yeah, I'll get you some advice. Whatever the vaccine requirements are, they have to comply with them.
Are you confident that Novavax will be arrived on time before the border reopens?
The intention of the Commonwealth is to have it distributed by or on February 21. By the time it gets out to GPs and pharmacies and wherever else, I can't tell you. We're a big state, but that's the intention, on or after February 21.
The 51 local cases today, any idea of breakdowns of how many are, under investigation, mystery infections, how many are close contacts? Because obviously close contacts are less of a concern than...
Yeah, the Minister might have those details.
And can I just wonder whether you have had an update on the rail repair work and the sort of truck flow into WA and where we're at with sort of eastern states cartage coming up?
We're expecting the rail will be repaired by February 15. The Minister for Transport and I had a hook up with major retailers from around Australia yesterday. So we're doing that. We did that last week and this week to talk about supply. We're expecting the rail to be repaired by February 15. But there's still a huge backlog. So the shelves won't be fully full for some months after that. But it's the sort of crisis, if you like, will be largely resolved when the rail reopens, but it takes time for trains to be stocked and come across and all that sort of thing. Look, in many ways, it isn't a crisis. We have food, and we have fresh food, and we have some staples, and people have been pretty good. People have not overwhelmingly cleared the shelves, so I think we can look forward to a resolution of this issue in coming months.
Already it looks like less people are going out and about and engaging in particular social activities because of the threat of COVID, which in turn impacts businesses and other organisations. Do you think as we continue into the next stages of the virus in WA that this will get worse?
Yes, I do. So obviously our close contact rules are constructed to reflect and reduce that impact, our close contact and isolation rules. But as we get further community spread of the virus, particularly when it gets to hundreds and thousands of cases a day, no doubt there will be further impacts, particularly on people's mindset who don't want to go out and run the risk of acquiring the illness. That will be a difficult period, and that's something a bit foreign to us because we've been through 2 years of basically very little COVID, minuscule amounts of lockdown compared to other parts of Australia, very successful and open community, very free society. That'll be a difficult period for us. Everything we are doing with getting the vaccination rates up, putting on hold the border opening so we didn't see thousands of cases within days, and all of the rules we're putting in place are designed to try and flatten the curve so we don't have the dramatic and awful experiences that New South Wales and Victoria in particular have gone through. So that's what it's all about. We can't actually say, we can't stop it, but what we can do is try and ameliorate the impact, which is what we're doing currently with all the measures we're putting in place.
Just back on the Commonwealth Games, is it the state who would solely pay for it, or does the federal government chip in?
I don't think they have before for a Commonwealth Games. They have for the Olympics, but I don't think they have for the Commonwealth Games, but I might be corrected there. But look, it's just, we live in a very uncertain world. Lots of threats out there, and we need to husband our resources for the things that matter most. Our healthcare system, our education system, diversifying the economy, making sure that we have strong finances as a state. So when we need to spend money on things that really count in the future, we have the resources available to us. So, COVID has meant, over the course of the last 2 years, the Commonwealth Government's debt levels have gone basically to $1 trillion, 1,000 billion, nearly 1,000 billion. Victoria, they've gone to 150 billion. New South Wales is tracking up about that far. We're down in the 30s, and we've actually been the only government in Australia driving down debt. So by doing that, you actually set yourself up to deal with major problems that come along in the future. And I think that's a more sensible way of approaching this than just saying we're going to spend more than $1 billion plus blowouts on something that's nice to have, but not necessary to have.
Inflation is rising globally. Do you think that will mean that repaying debt becomes more of a priority, or something you'll place more emphasis on as a state government?
Well, we have, over our time in office, only government in Australia that's paid down debt over the last 5 years. I would hope that will continue, and that puts us in good stead as interest rates increase. So interest rate increases impact governments like they do households. And those governments that have racked up massive amounts of debt will suffer far more than those governments that have kept debt under control. Our government, as you know, when we came to office, we had debt out of control, massive deficits. We turned all of that around, and that puts us in good stead to deal with COVID and other threats that might be coming down the track.
Premier, I'm not trying to be glib about this, but obviously a person dying who's unvaccinated, it does send a message to the community at this time, doesn't it?
That's the advice I have. I just want to be clear. That's the advice I have. Well, the message is there. Please get vaccinated. Please get your third dose. We're up to basically over 98, 99% first dose. If you're eligible for your third dose, please go and get it. It can save your life.
Yesterday, Minister Bill Johnson acknowledged there are a series of serious problems at Banksia Hill, particularly around staffing. I know yesterday you said there's no easy solutions, but would you agree there are serious issues with staffing there, and are there going to be more efforts made in that regard to try to resolve that?
There aren't easy solutions. There are not easy solutions to this problem, but there is improvements being made to the infrastructure at Banksia Hill. There's a recruitment underway with 40 personnel currently in training who'll commence on site in March or April, and further training courses being recruited too. So we're doing what we can to get more staff in there. It's not an easy work environment, very difficult work environment, but that's the process we're currently going through.
Are you concerned about the welfare of children there and of staff there?
Well, yes, and that's why you've got to protect the staff and the children. The staff obviously don't have an easy job. If you've read some of the material around, they don't have an easy job, but that's why we're recruiting and training more staff to work in Banksia Hill. Anything more from me? Good.
Thank you.
Thank you.
Thank you.
I can give you a breakdown of those figures. Bearing in mind the reporting period cut off last night, so some of those under investigation would have moved since then. But as of the last reporting period, of the 99 cases, we had 23 self-reported rats, which is great. 13 were overseas, 44 close contacts, 7 are under investigation, and 35 are interstate travel. Given the high number of close contacts, that probably explains some of those exposure sites. And with regards to the reporting of exposure sites, with the shift in the definition of close contacts, that significantly limits the number of exposure sites, and the public health team do a risk analysis, and they are at the moment publishing the most high risk exposure sites. Where there is a site where every person in and out of that site at that time can be accounted for, they don't publish. So for a school example, every visitor gets signed in and out, students are known, staff are known, so movements are people know. Same with businesses, then they are not listed as exposure sites.
So petrol stations, I mean, a petrol station with a 15-minute exposure window, that wouldn't meet the threshold to be considered a close contact. So why are they being listed but not a restaurant, for instance, or a nightclub?
Well, that's done on a risk basis by the health team, by the public health team. And if people are going into a petrol station or paying outside, for example, that may mean the risk is lower. So that's determined on a case-by-case basis.
And are people that visit exposure site like a restaurant or nightclub, for instance, not that we listed online, but do they get contacted?
Yes, they do. Yes. So where a business or a premises can account for their every person who came in and out, including staff, then they are all contacted by WA Health, and that is not listed as an exposure site.
Okay, and the Service WA app contributes to that?
Correct.
Of those 99 cases, can you confirm how many are children?
I cannot.
And are you aware of any other cases in aged care facilities at this point?
Not that I've seen this morning, although I would not be surprised if we see more. On aged care, certainly the state is very willing to step up and support the vaccination rollout, and we will do that. We've also been very clear. I've met with the major aged care providers as well as GPs and pharmacists, and my message to them has been we will not quibble on the ground about access to RATs and PPE. I know the Commonwealth is having some supply issues, or certainly getting PPE and RATs to Western Australia, and we have given them every assurance they'll have access to the state supply, and we'll work it out with the Commonwealth later.
So aged care operators can come to the state government and say we'd like RATs to do surveillance testing, for instance, and you would provide those RATs?
It'll be on a case-by-case basis, and depending on the numbers. I'm not sure that we'll be doing it for surveillance for every person coming in, but it would certainly be based on a risk approach and providing those RATs, yes.
You'd think that would already be in place, wouldn't it? Within aged care facilities?
Well, that would be ideal, and certainly the Commonwealth has had some issues in getting their PPE and their RAT supply to Western Australia. We have PPE and RATs, so we have said that they can have access to ours, and we will work it out with the Commonwealth later. We want to make sure that the staff and the residents are safe.
So, for example, the case at the moment, are you aware whether all the staff in there are fully PPE'd and have all the RAT testing they require?
My information is they have everything that they require, and that Juniper are in regular contact with the Department of Health and ensuring that they have everything they need. One of the biggest challenges for aged care, we can provide access to RATs and PPE, but one of their great challenges will be alternative workforce. And so we've been working with them, and I know the Commonwealth is working well with Juniper in stepping up an alternate workforce to allow those people to come in.
On the East Coast, most aged care providers now are doing surveillance testing every 3 days for both staff and residents. Is that something you would expect would come into play pretty quickly here in WA?
Well, aged care is regulated by the Commonwealth, and I would expect them to sort of step in and put in place some guidelines. But were there, with sufficient RATs available, then that's probably an appropriate approach with a very vulnerable cohort.
Have all of our healthcare workers been given RATs, and have all of our hospitals got RATs sitting there ready and ready to go?
So RATs are available for emergency departments, so they're being rolled out for every person who comes into an emergency department who's not in a life-threatening situation. In a life-threatening situation, they are still brought in, but given a rat in the ED, so that we're not slowing down their care. That's really the highest risk area for people coming in with COVID. With the restriction on visitors, we're able to manage that a lot better for broader hospital visitation. And in terms of access to other clinical areas and hospitals, yes, rats are being pre-positioned in regional areas, and that's been happening for at least the last week or so.
How long before you think all of our hospitals have got the rats that they need?
They have the rats they need now.
Can you confirm what the protocol is then for sporting codes that might be coming into WA, even if it's in this sort of fly in, fly out sort of basis, like in terms of vaccination?
That's worked out with the public health team and with the Chief Health Officer, so I'm happy to provide that for you.
But it would be 3 jabs, wouldn't it?
Well, if that's... Pardon?
If eligible.
If eligible, they have to be eligible. If that's now the requirement, then I would expect that is the requirement, but they also have to be eligible.
Minister, can aged care staff work across multiple sites?
I'd have to confirm that in WA. My understanding that is not happening, and providers are limiting that, but I'd have to confirm that. I mean, that is regulated by the Commonwealth. It would not be ideal at all for aged care workers to be moving from site to site in this environment, and I would expect them to have those plans in place.
I was going to say, so do you know what occurred at Juniper Signet in terms of the getting into there?
The seeding case. I think that's still under investigation, and I don't really want to comment unless we've got actual facts. It's certainly still being identified, but there are a couple of options that they're looking at.
So we've also heard there might be some COVID cases out in the goldfields around Kalgoorlie. Can you confirm that?
I can't at this point. That's probably with the public health team, and that'll be, if that is the case, that'll be in the next reporting round.
Thank you.
Okay.
Thank you.